A recent survey by the Washington State Bar Association found that nearly 10% of Washington's lawyers and judges reported suicide-related thoughts or self-harm last year. Nearly 10%. 1 out of 10 members of the Washington State Bar. That's nearly twice the rate of the general adult population. And that's not the only warning sign. Nearly 16% reported persistent feelings of depression and more than half symptoms of anxiety. That means Washington state lawyers and judges reported depression symptoms at roughly twice the rate of the general population and anxiety at roughly 3 times the rate. So this isn't just one alarming statistic, it's a pattern. Burnout, anxiety, depression, suicide-related thoughts, substance use disorder. And one of the most important findings is this. Of the bar members who reported suicidal thoughts or actions, almost 85% said their work environment somewhat or significantly contributed to them. Now that changes the conversation. This isn't only a mental health issue, it's a workplace issue, a culture issue, and for anyone who leads or influences a legal workplace, it's a leadership issue. Now, is this just a Washington issue? We really don't know. Washington's just the state with the most recent data. But do you really think the legal profession is that different in the state of Washington than it is everywhere else in America? Really? Maybe Washington is the outlier. Or maybe Washington is just one of the first places holding up the mirror. Either way, this report deserves attention from law firms, courts, government legal offices, corporate legal departments, bar associations, and anyone else shaping the legal work environment across the country. Because legal workplaces are still workplaces, and everyone inside them is affected by culture. The Washington data also tells us something important about the future of the profession. Among new bar members, 80% reported feeling burned out regularly or occasionally. More than 80% reported feeling nervous, on edge, worried, or in panic in just the past month. And 16% reported suicidal thoughts or actions, thoughts of self-harm or acts of self-harm in the past year. And of those new members, 100% said their work environment contributed to those thoughts or actions. Sure, we all own our behavior. We all have responsibility for how we care for ourselves, how we treat others, and when we seek help. But accountability isn't just with the individual. When the work environment is a driving force behind burnout, anxiety, depression, substance use concerns, and suicidal thoughts, the work environment has to be part of the solution. Many organizations offer support, employee assistance programs, health benefits, wellness committees, policies, and trainings, and most states have lawyer assistance programs. Those things matter, but they only become help when people feel safe enough to use them. And too often people don't. They worry about confidentiality. They worry about being seen as weak, unreliable, or less promotable. They worry about their license. So the work is not just to provide resources, it's creating a culture where people feel comfortable using the services and benefits already available to them. And this isn't about lowering standards in the legal profession. Given these statistics, I'd argue the standards have already been lowered. Not intentionally, but silently. Because people are trying to do high-stakes, detailed, heavy work while dealing with anxiety, depression, burnout, trauma, substance use, sleep deprivation, and chronic stress. It shows up in focus, quality, responsiveness, judgment, professionalism, attendance, turnover, and the way teams treat each other when they're under pressure. It becomes a hidden drag on performance. So addressing mental health at work is not a retreat from excellence. It's one of the ways you unlock it. And I know this from experience. For years, I was a senior executive at Kaiser Permanente. I led large teams and eventually ran operations for their multi-billion-dollar health plan in the Northwest. At the same time, I was living with trauma, severe depression, and anxiety that went undiagnosed for nearly 20 years. So, I'm not coming at this from an academic exercise. I understand the pressure of leadership, and I understand how invisible mental health struggles can be inside of high-performing workplaces. That's why mental health literacy belongs in all of our toolboxes. If someone started choking during a lunch meeting, most of us would recognize something was wrong. We wouldn't say, I'm not a doctor, so this has nothing to do with me. We try to help. But when more than half of Washington lawyers and judges reported anxiety symptoms, do we know what that looks like? Would we recognize it? Would we know how to engage with care and without judgment? Would we know how to guide someone towards getting help? That's where the tactical work starts, spreading mental health literacy. Not so people become therapists, not so people diagnose each other, but so leaders, colleagues, and people of informal influence know how to notice, ask, listen, guide, follow up, and normalize. Because one of the biggest barriers to help seeking is stigma. There's this insidious isolation cycle of misstigma, shame, and silence that keeps too many people struggling alone in silence. It's the myths like depression isn't real. They feel the stigmas like people with depression are just weak. And those stigmas drive feelings of shame like, oh my God, I feel depressed. What's wrong with me? Why am I such a weak person? And those feelings of shame drive the silence, so people don't call their lawyer assistance program. They don't call their employee assistance program. They don't tell a colleague. They don't reach out to a therapist. They don't ask for the help that they need. Not because the resources doesn't exist, but because the culture around them hasn't made them feel safe enough to use it. That's why leadership and informal influence matters so much. The job is to create and hardwire a culture of well-being inside your firm, team, court, agency, department, or organization, alongside all the other values you expect people to show up with at work every day. Performance excellence, client service, professionalism, integrity, accountability. Well-being belongs in that same conversation. Not as a soft add-on, not as a poster, not as a once-a-year wellness week, but as part of how the organization actually operates. And that starts when leaders and people of informal influence normalize the topic of mental health by learning the signs that someone may be struggling, by learning how to engage them with care and without judgment, by learning how to guide people towards services and support to get help, and by learning how to follow up. And by modeling that mental health isn't something to hide from, joke away, or whisper about, or only address after a crisis occurs. It also means leaders have to be willing to share their own stories with honesty and vulnerability and authenticity. Because no one is likely to share them with you if you're not going to share yours with them. You know, when senior leaders stay silent, silence becomes the culture. And when senior leaders speak with humility and humanity, and others have permission to do the same, that's how the isolation cycle starts to break. That's how existing benefits, EAPs, lawyer assistance programs, and policies actually start to help. The Washington State Bar Report is worth reading, but more importantly, it's worth acting on. Not as a public relations exercise, not as a compliance project, not as another poster, but as leadership work. The kind of leadership work that helps build legal workplaces where people can meet high standards without sacrificing their health, their families, their well-being, or in the most heartbreaking cases, their lives. That's the opportunity in front of the legal profession today, and that's work worth doing.